Good morning, good morning. It's day 2 of my week of lives on Facebook, and if you're an early bird you can catch me on Instagram at 9 a.m. as well. I'm coming on every day this week to talk about my passion. My passion is all around scar tissue, surgery and injury recovery. I think as a manual therapist there is so much that we could do, and for many instances lots more that we could be doing than we're currently doing in terms of providing really great advice, really high quality manual techniques, and lots of home care advice for people to be able to support and continue what you're able to do in clinic at home as well. So I'm coming on every day this week to try and promote the Understanding Scars advanced online theory course, which I produced back in lockdown together with Hannah Polton at HLP Therapy, collaborating on the content to get that physio input. And it was a really in-depth course which has had lots of 5-star reviews to really provide more than a foundation, like a really high quality knowledge on how injury and trauma can cause lasting effects and what we can do within a clinical setting to really support recovery, with loads and loads of different advice, lots of considerations for different types of surgeries, different types of injuries, burns and so on. And so the lives this week, the discount code for Understanding Scars, which is now on half price, is Live 2024, and all of this week I'm talking about things to do with scar tissue and surgery recovery. If you missed it yesterday, I was doing take note documentation for clients after injury and surgery, so looking at all of the things you might want to consider with your initial intake and also documentation of treatment. And today I'm here talking about get moving, scar tissue and stiffness. And then tomorrow you can join me. What am I doing tomorrow? Have a drink, hydration and scar tissue. Thursday, keep it up, fluid build up after trauma and surgery. And then on Friday, it's got to be mix it up for Friday, hasn't it? So mix it up and looking at how varying your treatment approach is the best way to really get continued improvements when you're working with people after injury and surgery. If you think about it, when you go and, with all things in life, whether it's what we eat or what we do for exercise, we don't just want to keep doing the same few things. It's variety that actually really benefits our body. Therefore, in your clinical setting, you need to make sure you've got a varied approach to treating scar tissue, and that's going to get you the best results, to get movement better, to get quality of life better, to get visual improvements in the scar, to get changes in pain, sensitivity, all of the things that we know are really common issues when somebody's had a trauma or an injury. So on to today, and thanks very much for those who are with me already. So today I'm really going to concentrate on that thought about the fact that scar tissue, even in the best case scenario, is stiffer, it's less mobile, it's more contractile than healthy tissue. So pre-injury tissue is pretty flexible, whether that's the skin or our underlying fascia. And then when you've got that wound healing process after an injury, the skin does not repair like for like, so you get a lot more stiffness in the skin, and the skin is providing lots of sensory feedback, and that in itself sends messages in relation to sensitivity and pain. And then we've also got the sensory function and the movement function of our underlying fascial system. And in early healing you have got immature scar tissue formation, which often can present a view of actually things seem quite good, you've still got mobility, and where we need to be really hyper vigilant is during that early healing phase to make sure that you're actually really working that scar tissue and making sure that you can work through all of the range of movement around an area as soon as possible, when it's advisable to do so within any sort of deeper suturing and deeper repair that's going on that we wouldn't want to put too much strain on. But the minute that individual has been told by the surgical team that it is a good idea to start doing movements to the full range within that part of the body, then you do want to be doing it. if we look at what happens with people who've had a really significant trauma, like a burn trauma, they'll be at risk of getting scar contracture. So if somebody had a really significant burn to their hand, for example, and they had lots of burn scarring, they'll often be splinted for part of the day or in the evenings and so on, to make sure that that tissue doesn't start, as it matures, to contract so significantly that they lose range of movement in their fingers. And luckily, lots of individuals that you might see in your clinic are not going to have that kind of big significant injury, but we need to look at what scar tissue does in those bigger injuries, because that's happening on a smaller scale in smaller injuries as well. If that happens, if you get a bit of sort of tightness, stiffness and contracture through the abdominal area in a relatively small scar, you're not really going to sort of pick up on it too much, because you've got lots of tissue around which can compensate for that lack of movement. But it could be causing ongoing messages through our sort of sensory system, which is then triggering an inflammatory response, because the body doesn't like the fact that there's this stiffness and tightness, and that in itself can then lead to change in movement patterns, change in the way that we load, and ongoing scar tissue production. So thinking about how we can really make sure that we keep stretching and moving that scar tissue, both from early healing through maturation and with mature scars. And you can still have an impact on the mobility of tissue with mature scars, but you've already got more embedded issues around the scar than you will have if you work with somebody and you manage to get working with them from much earlier on. So certainly on the Restore Therapy courses, we bring in lots and lots of stretch techniques that you can use on and around the scar tissue to think about different ways of mobilising that scar in those early healing phases, in order to make sure that we do have a way of helping support that scar tissue during that maturation as it stiffens up, and think about how that patient might be able to do that at home as well. And we could be advising that they obviously do some stretches, but there's other ways that we can change those tensional forces and stimulate scar tissue. So one of them might be using kinesio tape. So you've got something like the punch tape from CureTape, a really great idea for sort of changing those tissue dynamics, providing lots of different sensory feedback. And then you've got the new tape, for example, from RockTape, which is really responsive to the tensional force around an area, providing different stimulus. And these range of different products that you can look at and think about, okay, well, if I see a client after injury or surgery and they come to me for an appointment in my clinic, it's unlikely that you're going to be seeing them on a daily basis, and you need to think about, okay, well, how can I support them at home? What is it that they can do in between treatments? Perhaps leave them with some K-tape applied, in which case they're having an ongoing sort of stimulus over the next few days, keeping that treatment going for longer until you see them again. And we cover K-taping for scars on our Scar Therapy Practitioner course. And the other thing that you could think about is perhaps some self-massage, self-stretching, ways of them mobilising that tissue in between their appointment times with you. Because if they just leave it to stagnate, it's not really going to be sort of doing so much. And we really need to think about catching on that momentum of when the body's in early healing. Then we've got adhesion formation. Adhesions as well, they're stiff, they're tight, they cause puckering, they can cause tissue to kind of overhang. Our clients don't like them, but they've also got a really important kind of functional role. Like you get more complications around a joint when you've got adhesion formation. You've got to change through that deeper fascia tissue. So if you've got somebody who's had a keyhole surgery, perhaps an appendix removal by keyhole surgery, it can seem that, oh, it all seems quite nice. We've got very small scars on the surface. They've hidden one scar very neatly through umbilicus, normally try and tidy that up in the belly button. But what's going on underneath, and is there some ongoing inflammation which is actually causing other complications? Could be stiffness in the hip, could be tightness around that area, could be causing low back pain, and could end up with little tucked adhesions. People who've had surgeries to sort of pelvic surgeries often end up with adhesions in that bikini line scar down there, and can end up with adhesions on giving bladder kind of complications and stimulus. Obviously you can have bloating with any abdominal surgery. So thinking about if we can keep that tissue loose and mobile, we're less likely to be irritating those internal organs as well. And what else could they be doing that could affect that quality of the scar tissue? So is there something you could be thinking about in terms of more holistic approach to thinking about how the body is working through that repair? We can only repair with the fuel that we're putting in. So if your client is following a very inflammatory diet with quite restricted nutrients, then they're actually going to struggle to have that high quality of repair. They're going to keep their body in a state of inflammation. So perhaps thinking about advising them to have a diet review, going to see somebody to work out what else they can do to really bring down that inflammatory status, getting more exercise, drinking more fluids, all of those things that we know are really supportive of the body system as a whole. So that's my little talk today on scar tissue and stiffness. I hope that's been useful, and there's so much more that you can learn about scars on Understanding Scars Advanced Online Theory, and it's got 50% off with the coupon code LIVE2024. If you've got a historic course, if you signed up and didn't have a chance to complete the course within the 12 months, you can, for a very nominal fee, just reactivate on a month-by-month basis. Go back in there, pick up some more knowledge and take that into your clinic to start supporting recovery on a higher level after people have injuries and surgeries. And let's get this information out there. We really need better quality of advice and more skilled and qualified therapists to be able to help people after surgeries and injuries, because these are happening every day to so many of our clients, and quite often they're just brushed aside as small things, and we could be providing some really simple core advice to help support their recovery and improve their scar healing. Hi Tina! So you've got coming tomorrow, keep it up, fluid build up after scar, oh no, tomorrow's have a drink, scar tissue and hydration. Then on Thursday is keep it up, fluid build up after surgery and trauma. And Friday we've got to mix it up. So talking about how really bringing in variety, being able to step through a program of scar tissue treatment. Scar tissue treatment is not just one or two techniques done repeatedly on the scar. If you come and learn on a comprehensive scar therapy course, you should understand what's appropriate in early healing, how to adapt and move and integrate new techniques as you move through a healing timeline from really immature scars which need certain types of techniques and treatments to working with quite advanced clients who you've been working with for a long time, who you should be really stepping up the program of what it is you're doing to stimulate and promote changes in their scars. So have an amazing day and look forward to seeing you tomorrow. Please share this in the community. Bye bye bye.